And we're back now at 8:10. How far would you go to save your pet's life? Americans spend nearly $40 billion a year on their animals, with more than $9 billion going to veterinary care alone. Recently, our own Jill Rappaport got a first-hand look at what veterinary care has to offer these days.
Yes. See how good he looks? He's like, oh, I know where I'm at. Right. It's okay, bud. Come on. Come on. It's okay.
It's Jack Rappaport's last day of chemotherapy.
You a good dog?
After having his leg amputated, it's the final hurdle in a 6-month fight against osteosarcoma, or bone cancer.
What is your last chemo today? What? Oh,
Before each round of chemo, oncologist Gerald checks Jack's weight
what a good dog.
and blood to make sure he's strong enough for treatment.
I got the
results.
results. They're okay. I'm going to dose reduce him just a little bit. Okay?
Okay, sweetie. This is your last round.
Then his team prepares and administers the drug.
I'm always on edge. I can barely talk when I'm there.
If it seems like Jill is caring for her own child, that's because she is.
I don't have children, and these are my children. Jack is a German Shepherd. He'll be 12 in May. Then there's Sweet Pea. She's going on 7, and we think she's a coon hound. Then there's Buckaroo, our yellow lab. He's going on 5, and our youngest, CJ, a Havanese, and she just turned a year old. And you look into their eyes, and when they run to the door, there's nothing better. You know, those wagging tails, I'm in love with my animals. I'm in love with all animals, which is why I have 10. Lots of smells.
That's right, 4 dogs and 6 horses.
My dogs love the horses, especially Jack.
Like millions of American pet owners, Jill feels her animals are her family. So when she noticed the first signs of Jack's illness, Jill was devastated.
All of a sudden, he started limping. Well, one night at the end of September, I looked down at his leg, and I saw a very slight bulge, and my heart stopped.
Fearing the worst, Jill did what any parent would do. She sought the best care possible. The bustling staff, the high-tech equipment. It could be a hospital for people, but it's for their pets.
The Center for Specialized Veterinary Care is unique, and it's unique because it has almost everything possible that you can give in specialty medicine under one roof.
That includes radiation therapy for Casey the cat, a CAT scan for Mookie the dog, aquatic therapy for Annie, a 1-year-old German Shepherd, and a dermatology checkup for Brutus, the chocolate lab. Not to mention the MRIs, ultrasounds, surgeries, dental work, and endoscopies performed regularly.
Specialty medicine has evolved, just like in human medicine, to give pets the very best care. We have the technology, we're able to do it.
And for 15,000 patients a year, they do. Among the specialties increasingly available, cancer treatment for your pet.
There's been an explosion in knowledge over the past, 5 to 10 years. The diagnosis of cancer is no longer a death sentence. And I really thought that Jack could handle both the surgery as well as the chemotherapy.
He looked right at Jack's eyes. He said, I can tell. He's healthy. Other than that leg, he said, give him this chance.
And after tests revealed the cancer had not spread beyond Jack's leg, she did just that.
Now, right after surgery, Jack was literally rolled into this room. And it's a mini hospital room where I was able to stay with him all night.
It's another example of the options coming to pet owners. And as specialty veterinary care booms, it's not just our 4-legged friends who stand to benefit.
When I treat an animal with cancer, not only am I helping that animal, but I could potentially be helping a child with cancer in 5 or 10 years from now.
As for Jack, on his last day of chemotherapy, his prognosis is good.
I think at this point, Jack could not be doing any better. I think that Jill is doing everything possible for him.
Now look how much faster he goes out of here than he comes in. He's like, bye-bye. It's okay, bud. That's your last one. This is my idea of total bliss. To be in my home, surrounded by my babies. I would go to any length and any expense to extend their life, to save their life, as long as they're not in pain.
And Jill is here this morning with her dog, Jack. Good morning to both of you.
Hi, Meredith.
Hey, 6 months after treatment, how's Jack doing?
Oh, well, knock on wood, he is doing really great. In fact, just the other day, he got on the scent of a deer and ran into the woods. And a year ago, I would have been chasing him and yelling at him. I was like, go, go. I was so thrilled.
So he's okay on just the 3 legs? Because I know some people might worry about amputation. Can a dog really function as well?
Well, we had, an idea going in that he would be okay, because with the cancer-ridden leg, he basically had it up in the air
anyway
at the end. And so he really had great balance. And the vets were so wonderful because we did extensive tests to make sure he didn't have hip dysplasia, not severe arthritis.
He was the right candidate, exactly.
And also he's a small shepherd. He's not top-heavy, chest-heavy. And that really makes a difference.
I'm sure a lot of people are watching and fell in love with Jack, but this is obviously extremely costly what you did for your dog because you love your dog. But for people who may not be able to afford this kind of intervention, are there any options that could defray costs?
Right. Well, something that I didn't have, pet insurance. And I didn't realize, Meredith, that less than 3% of pet owners actually have pet insurance. And it would have covered all of these major procedures, and I have 4 dogs. So once he gets through this, now that he's done, I'm definitely going to
be getting the pet insurance.
Yes, for my other dogs as well.
Well, you really are the true Jack and Jill. I'm telling you. You went up that hill the hard way, and you made it down, both of you. Congratulations and thanks. So many wonderful things going on in veterinary care, important information. You can read Jill's blog about Jack at our website at todayshow.com. Good boy, Jack. Up next, the pressure to be thin. We're going to take a look at the rise in eating disorders among teens and young adults. But first, these messages and a kiss from Jack.